I'm Dr. Amy Phillips, and I practice obstetrics and gynecology at UAMS. So a tubal pregnancy is when the pregnancy implants in the tube rather than inside the uterus, and this can actually be a life-threatening condition. Some risk factors that would increase the risk that you might have a tubal pregnancy are a history of having a sexually transmitted infection, a history of pelvic inflammatory disease. If you have extensive endometriosis, that can also increase your risk. And then also having any kind of surgery on your tubes before. So if you had a prior tubal pregnancy, that definitely increases the risk. And then again, also, if you had your tubes tied and then had it reversed, that's surgery on your tubes. And so that would also increase your risk of a tubal pregnancy. The symptoms of a tubal pregnancy can really vary quite differently between patients, but the most common theme is pain on one side or the other of the pelvic area. You most likely had a positive pregnancy test if you knew you were pregnant. Sometimes we have patients who didn't even know they were pregnant when they come to the emergency room with pain, and we diagnose them with the pregnancy there. But if you know that you're pregnant and you're having pelvic pain, especially if it's limited to one side or the other, and sometimes people will even have vaginal bleeding even though they are pregnant. So if you have any of those symptoms, I would encourage you to seek treatment. Treatment of a tubal pregnancy really depends on how early we diagnose the problem. So if it's very early in the pregnancy, we can often treat with medication, which is given through an injection, and then you have to have very close follow-up to make sure that the pregnancy resolves. If it's a little bit later in the pregnancy, then often it's treated with surgery. Depends on how far along the pregnancy is, what kind of surgery we might perform. If it's, again, early in the pregnancy, sometimes we can just remove the pregnancy out of the tube and leave the tube there. But if it's really more advanced, then a lot of times we'll end up having to remove the entire tube. There are several ways that I'm inspired by my patients, but one specifically that just is dear to my heart, and it's that I love to see women persevere through pregnancy losses. It's a very difficult time, and having some personal experience in that area, I really feel like I connect closely with my patients. I really feel like I can be there for them and support them in a way that helps us build our relationships and make that bond between myself and my patients even more special. It's just so inspiring to me. It's just amazing to see the strength of women and how they can bounce back and really grow from these experiences.